Kalimera, good morning, everyone. I have to stop here because my Greek, in spite of 4 years in this beautiful country, is not improving. I have to acknowledge that. First of all, congratulations to the Hellenic Cancer Federation, in particular, my dear friend George. You're doing a fantastic job, and I would like to commend you and thank you for the invitation on behalf of WHO in Greece, but particularly on behalf of our regional director, Dr. Hans Kluge. I would like to commend you for all the work done to fight cancer, which is really one of the biggest challenges we have in Europe. Also, if you allow me, a word of welcome to the honorable MEPs and all the representatives from different organizations here in this meeting today. It's really a show of force to see so many institutions and stakeholders. That's the right thing to do, and that's really the way to go. I think that we all acknowledge that we need to have civil society, scientific organizations, and others to really make sure that we move forward in terms of education, prevention, support and empower patients, improve patient experiences in the field of cancer is really so important so that we have a comprehensive approach. It's like in an orchestra, right? Everyone needs to play its part, otherwise it's not going to work. It's way beyond just treatment. Treatment is very important, but it all starts with prevention. And we in WHO, we believe that cancer is one of the great challenges we have for health, but also for humanity. We've gone a long way, so much progress has been achieved, but not everyone benefits from this progress. And particularly, it's really very important to consider the most vulnerable in terms of countries, in terms of groups in our countries, and so on and so forth. So we really have a long way to do in the area of prevention, early detection, and high-quality treatment. At WHO, we firmly believe that quality healthcare is a fundamental right, and it's really a priority for us. It's not just about access. This is why the visionary approach by the Greek people through your governments have provided WHO with the resources and with the support to establish a unique initiative in Greece, which is the Athens Office on Quality of Care and Patient Safety, which is unique globally. And the European region of WHO is the only one that has a specifically dedicated outposted office that belongs to the regional office, but it's mainly focused on quality of care and patient safety because you've understood that is way beyond access, is about care which is safe, equitable, and really patient-centered. In spite of all the progress that has been done in many countries, Greece including, many changes remain, many challenges persist, particularly in prevention, in screening and control. And we all know that. I mean, it's like preaching to the converted, but a lot of work needs to be done. And sometimes devil is in the detail. So we would like, and we always advocate for a public health approach to cancer that goes from prevention to long-term and palliative care with all the things in between. And this is absolutely critical. And you can only do that if you do it together. The health system that needs, of course, to excel, and it's not always easy, starting from primary care to the highly sophisticated type of approach that we all need. But we can only do that if we do it together. It's a responsibility of everyone, policymakers, health professionals, but also civil society. And I commend this group for all the energy and the investment that we put into it. So for us in WHO, of course, we couldn't but associate with these great initiatives you have here. I have a series of proposals. I would do it during the roundtable if you allow me, so don't go away. Also provocative and challenging things because not everything works well in the world of cancer in the European Union, very wealthy and rich countries. There's a lot still to be done. We all have to acknowledge that. There are powerful forces that are not helping, particularly to prevent cancer. Those need to be addressed. And also a lot of things that, because we need to put our house in order. If we are from the health sector, we really need to be better aligned and better organized and really serve our patients in a better way, with dignity, with respect, putting them at the center, really improve the experiences so that we focus on the outcomes. The outcomes are important for the patients and their families, not so much for the health professionals. Therefore, if you're a doctor or if you're a nurse, you need to think about all the parkour, right? All the process. Because what counts is the final result, not just that small period when you have an interaction with your patient. It's the final outcome that counts. And normally we haven't been measuring that well. What gets measured gets done. This is also one of our let's say, points, something we would like really people to focus more. And this is why we have what we believe is a great project with the Ministry of Health in Greece, which is for the first time bringing all your data from all sources with a focus on quality of care and patient safety for the first time together. This project called Health IQ is going to be really a huge lever to promote better healthcare in Greece. So again, thank you very much. Let's do this together. I'm very happy to be here, and I wish you all the best for the day. Thank you.